And then if you are a guest tonight, raise your hand. Okay, good. We've got a pretty good mix of everyone tonight. Who's been to Dr. Arbeitman's talk before this one, like our annual dinner? Okay, a few. Good. You still have to laugh at all of his jokes. Now let me give a brief introduction and we'll get started. Dr. Larry Arbeitman is from Manalapan, New Jersey. He attended the University of Maryland and then Life University and received his doctorate from Logan College of Chiropractic in 2003. 20 years ago, exactly, wow. He is the founder of Upper Cervical Chiropractic of Monmouth, located in Marlborough, just on Route 9. And his office, Upper Cervical of Monmouth, has served over 300,000 patient visits in the last 18 years. Isn't that amazing? He's become very well respected within the profession, and most specifically in the upper cervical specialty. He's currently an active board member for the QSM3 method, which is the method that we use to adjust our patients, some of you, at the office. Dr. Arbeitman travels and teaches all over the country to colleagues, students, and the general public, including you tonight. Tonight he will be highlighting several key points of the book. You see this around the office sometimes. Have you guys seen this?
Yeah.
The Path to Healing through Upper Cervical Care. It's called The Gift of Hope. And we have one here if you'd like one after the talk is over tonight. I'm so glad you're here. After 21 years in practice for me, I've listened to a lot of chiropractors say a lot of words. And Dr. Arbeitman is arguably one of the best chiropractors to talk about the message of chiropractic and truly what we do at the office. And so I'm really glad you're here tonight if this is your first opportunity to hear a chiropractor talk about how we practice and what we do. So welcome, thank you, and please stick around after and ask questions if you have anything.
If you can remember that applause when I'm done, the hardest part is over. Me just waiting to come and share what I want to share with you tonight. Are you guys okay if I speak without a mic? Because usually I have a lapel and I can't be like married to this thing tonight. So I will project, and if you can't hear me, you let me know. By a show of hands here, how many people want to be healthy and happy? So we all have something in common, and hopefully some of the insights that I'm going to share with you this evening will help all of us have more of that. Now, by another show of hands, how many people in here have a birthday? Awesome, we have a lot in common. Now, how many of you have a birthday today? Okay, if it's not your birthday, what I want you to do is go onto your phone and silence your ringer. Because we know if your phone goes off, it's your birthday, and we're all going to turn and sing happy birthday to you.
I don't want to knock you down.
All right, you good with that? And if you don't know how to shut your ringer off, ask the person to your right. Okay. So it's kind of like a birthday. May 2nd, it's always been a really special day. I shared that with you. It was May 1st, 2005, Sunday, May 1st, and I went to the Freehold Mall. Back then, they let you purchase a spot. And I went there with my spine, my folding table, and my passion and mission to serve humanity. And I knew I had something good, for good, to do good. And I just needed to get this message to the people. That's why I'm here tonight. So, it's Monday, and I met 4 people at the Freehold Mall that day, and we had a nice conversation, and they agreed to come into the office, and I asked my mom to come and sit behind the front desk, because you need to have somebody behind the front desk when you meet your first new patients. And those 4 people came in, and the rest is history. Thank God. But I do feel like we're just getting started. I feel like there's so much more. And for me, it feels like this ice rink that's just collapsing behind me, and I'm running and just trying to get to as many people as possible. And I won't stop because I really believe this is what I was put on this planet for. So thank you for allowing me to just share a little bit of my purpose with you, for you, not for me, but for you. So many of you may be thinking, why a chiropractor and why a dinner? I mean, by a show of hands, how many of your internists have taken you out to dinner? I realized really early on that there was a chasm or a gap between what we actually do as chiropractors and what the public thinks we do. And I realized that I was going to have to try to fill that gap and that chasm. And this is one of the ways over the last 18 years that we have done that. And I do believe in my heart of hearts that we save lives in our practice every day with the chiropractic adjustment. Now you may think that that's a bold statement. I don't mean like emergency medicine saving lives. I don't mean like if there, God forbid, was an accident out on Route 34, that if somebody's arm was dismembered, that you're going to bring them in here, I'm going to touch them on the side of their neck, and they're going to heal up. Like, that's not how we save lives. We save lives a very different way. There was a dinner, God, it's probably about 12 years ago now, 13 years ago, where Pat stood up and told the story. And for those of you who have heard me speak, I start with this story because none of us would be here if this didn't happen. I was a new practitioner, and Pat, the mother of Stephanie, calls my office and she said, I hope you can help my daughter. She was a grade A scholar athlete at Freehold Township High School, a gymnast, and she was out to the movies with her friends, and she literally went paralyzed from the neck down. She couldn't move. And they rushed her up to Robert Wood Johnson. They ran the battery of tests, and they came back with a diagnosis of Guillain-Barré syndrome, which, for those of you who don't know, that is a progressive neurological disease that can result in respiratory failure and death. And she was 15. And her movement came back, but she was left with such bad chronic pain and fatigue that she couldn't go to school, she couldn't go to gymnastics, she had no social life. The parents took her up to New York City to the biggest and best on Park Avenue. They took her down to CHOP. They took her to the rheumatologist, infectious disease doctor, orthopedist. Finally, they said, it's in her head, find a child psychiatrist. That's when Pat found our office. And I answered the phone because my mom wasn't working that day. And you know, you look back and like God gives you these moments, like step up, like this is why you became what you became. And I said, come on into the office. And I said, there was a moment where your daughter was well. There's a moment where she wasn't well. If she has pressure on the brain stem, the area of the nervous system that connects the brain to the body and the body to the brain, and I can detect that pressure and I can take that pressure, that interference off of that brain stem, let's see what your daughter's body's going to do. And it's not like we did that first adjustment and boom, Stephanie was healed. Because that's not how healing works. Healing takes time. Just like education, just like planting a garden. So with enough, healing takes time. Time and repetition. It says it right up there. We could not have scripted that better. Time and repetition. If you do the right thing enough times over time, the body will move in the right place, in the right direction. And so we started taking pressure off of Stephanie's brainstem, and little by little, her life started to return. She was able to get back into school for a half day. Then maybe a month later, she was able to get into the gym again and watch her friends tumble. And then one day she was able to go socialize, and then it became a full day at school. And then she was able to tumble, and the months went on. And I'll never forget the day that Stephanie came in the office and she said, Dr. Larry, I did giants. Who knows what giants are as a gymnast? That's when they go around again. And that alone, when Pat told the story at that dinner, was enough to make the whole room cry. But the years went on, and Stephanie graduated high school, and she went to Seton Hall. She became a speech therapist. She met Ronan, her husband. They now live in Jersey City. And I'll never forget the day of her wedding. She came down to Marlboro. She picked up her dress. She came in for an adjustment, and she went and got married. the sweetest thing happened this year.
She had a baby.
She brought her baby. And we started taking care of Shay. And I wonder every day, I think of Stephanie, and I've told her this, how many more Stephanies are out there? And what if Stephanie's mom didn't call that day? And what if I didn't answer the phone? Do you think her life would have been on a different trajectory? Would she have still been under the care of her parents? Would she have gotten married, become a speech therapist, had this beautiful daughter? We save lives with the chiropractic adjustment, and the 5 of us won't stop, because for us it's a mission. So there's another way that we save lives. You ever hear the opioid epidemic? It's killed 500,000 Americans in a 20-year span. And they knew it was going to be addictive. And this epidemic affects all of us because we all know somebody who. These aren't addicts. These are mothers and fathers and uncles and brothers and sisters. And I'm very proud to say in the hundreds and hundreds and hundreds and hundreds of people we care for in our practice, no one is on opioids in our practice. Maybe we've prevented them from going that route. Maybe they came with them and were able to get off of them, or maybe we just showed them another way. So as we speak tonight, I want you to think about that maybe tonight's talk isn't just for you. Maybe it's for somebody else in your house or in your community or your family. Let me give you an example. It was 2012, so 13 years ago, and we did a dinner just like this. And Phyllis, our patient, brought her friend Linda. And Linda pulls me aside after the talk and she goes, I have a friend Barbara whose son is going to go to medical school. He goes to Monmouth University and he needs an internship. Can he shadow you? Another one of those like just God moments. Like I said yes, of course. And I said, why does he want to shadow a chiropractor if he wants to be a medical doctor? And so PJ is his name. He came in and he started shadowing us once a week. And he pulled me aside one day and he said, Dr. Arbeitman, I never told you this, but I suffer with migraines. I miss a lot of tests. I don't take long trips with my friends. They have to make special arrangements for me at school. And I'm seeing all these people who used to suffer with migraines tell me how great they're doing. Would you mind if I start getting care? And so we started taking care of PJ, and by the end of that semester, he changed course. He is now a chiropractor, practicing in Wisconsin, taking care of hundreds of people because of a dinner like this, where Phyllis brought Linda, and Linda had the courage to pull me aside and ask, and there's Phyllis and Linda. So over the next 20 to 30 minutes, what I'm going to do is explain to you, we'll come full circle on how did that actually work? How did PJ and Stephanie and so many others in this room, there's people in this room that avoided surgeries. One man avoided a brain surgery this year. Another woman that comes to mind that's sitting in this room avoided a spinal surgery if she went the conventional route. How does that happen? How does that heal? How does that work? And we're going to talk about that. Now, I asked everybody a moment ago who wants to be healthy and happy, and you all raised your hands. So here's a trick question. How do you know if you're healthy? How do you know if you're healthy? Anybody want to take a stab at that? The patients know the answer. Everybody else is scared. I want to pounce on them. Do you guys mind if I take this off? Just the jacket. Phyllis. Typically when I ask a room like this, how do you know if you're healthy? People will say, well, if I feel good, I'm healthy. Right? If I feel good, I'm healthy. Not so true. Think about this. Cancers, cardiovascular disease, atherosclerosis, osteoporosis. These are some of diabetes. These are some of the worst chronic conditions that we have. And these people feel good until it's either advanced or they get a test and they're told they should feel bad. And on the flip side, we've all gotten up in the middle of the night. You ever stub like just the outside of your pinky toe on the corner of the bed? And you know the pain's gonna come in about 3 seconds, right? And you're hopping around the room in the middle of the night, but it doesn't mean you've lost your health. You just hurt for a second. And if somebody breaks an arm, it doesn't mean they lost their health. So just looking at how we feel to determine whether or not we're healthy or not, or doing okay is not a great strategy. So the other thing I'll hear is, well, if I'm not sick, I'm healthy. If I'm not sick, I'm healthy. Well, let me ask you a question. Would you rather be pretty or just not ugly? Smart or just not dumb? Would you rather be rich or just not poor? Would you rather be healthy or just not sick? Because here's the thing. If we have a continuum and illness is here and wellness is here, not sick is right in the middle. And people live their life between symptom, not sick, symptom, not sick. And the thing that's less obvious is if you're alive, you're either moving one way or another, whether you like it or not. Because nothing alive is staying still. Your pets, your garden, or your body. And so we have to have a strategy that pulls us, that moves us in this direction. You cannot leave it to happenstance. Imagine having a child and just saying, I'm going to leave their education to happenstance and just see where they end up. So going for blood work once or twice a year is not a complete health strategy. I'm not saying that's not important. All that is early detection, right? You just go, you get your results, and you find out how you've been doing. It's like a report card in the rearview mirror. So if you think about your calendar, you have to schedule appointments with yourself because your health is your most important asset. How many people here are healthier today than they were 5 years ago? Raise your hand. All right? That's awesome. Let's celebrate that. Let me ask this question. How many people here, this is an important one, believe it's possible to be healthier 5 years from now than today? Yes. That's an important belief system to have, because if you don't have that belief system, it probably won't happen. Now, if I ask those 20 people that raised their hand, what did you do over the last 5 years to restore your health? They're not going to say they found a new pill or they've got a great surgery. They're going to say, I started moving my body more, I started sleeping more, I fixed up my nutrition, I got rid of that bad relationship, I changed my job, I shut the news off, I started meditating, I found this great chiropractic office in Marlboro. It's always lifestyle. Folks, better health through better chemistry has failed. It's failed. Think about this. One of the ways we can judge the health of a society is longevity. How long we all live as a collective. And I actually looked this up. I actually used Google, not ChatGPT. And I said, tell me longevity statistics. So by a show of hands, how many people believe the United States of America is in the top 10 in longevity in the world? No. Okay. No. Top 20? No. Top 30? No. Top 40? No. No takers on 40? No. 46. Behind Estonia, Cuba, and Poland. Wow. Dr. Google said it. It's got to be true. I'm going to drink this. All right. So you would think that with the biggest and brightest minds in medicine, the biggest and best institutions, and don't hear me wrong, if the stuff hits the fan, there's probably no other place I'd want to be on this planet than here to get that help. But you can't go into the sick care system for healthcare. It's not a healthcare system, folks. It's not a healthcare system. Let me give you some statistics. And I just started wearing readers, and I clearly don't have them. In 2019, the U.S. reported the highest per capita spending in the world on healthcare. There are more than 20,000 prescription drugs that are approved for marketing. About 66% of U.S. adults take prescription drugs, and the average number is 4 medications. The most commonly abused types of prescription drugs are opioids, tranquilizers, benzodiazepines, and prescription stimulants like Adderall, Ritalin. The U.S. consumed about 30% of the world's supply of opioids in 2015, and almost 50,000 people died from overdoses in 2019. That model is failing, folks. If you walk into 2 people's houses, one person's got a medicine cabinet full of medicine, and the other person has no drugs in their medicine cabinet. Who's the healthier house?
No medicine.
Now, don't mishear me. Don't stop taking your medicine because you heard me speak tonight. It's going to end up on social media. He said I should not take this. No, folks, you have to earn the right to not take those medications. You got to do the work. You got to do the work. But guess what? You're worth it. Your greatest asset is your health, and it affects every single aspect of your life all the time. Without your health, you don't have physical health, meaning you can't do physically what you want to do when you want to do it. You don't have intellectual health. If you don't have your health, you can't read and learn and stimulate your mind. You don't have emotional health when you don't have your health. You can't show up as the best version of yourself. When you don't have your health, it affects your spiritual health, your ability to feel connected to something greater than yourself. You know what you can't afford in this country? You can't afford to get sick. When you don't have your health, it affects your financial health. Half of all bankruptcies in this country are due to medical expenses. It affects your career. People stop climbing because they lose their health. It affects people's social life. I can't tell you how many new patients tell me they cancel plans because of the migraine headaches, or because of their facial pain, or because of their sciatica. It affects your relationships with your children or your grandchildren. Your health affects your most important relationship, your love relationship, your ability to be with and connect with your partner. It affects your quality of life. If you go to the Grand Canyon this summer, will you hike down into the Grand Canyon, or are you going to walk up to it and go, nice hole? And at the end of the day, this is what we sacrifice when we don't pay attention to our health. Your purpose. All of us are going to be looking back one day on our lives, and we're going to be asking ourselves, did I do what I was supposed to do? Was I able to achieve what I was supposed to achieve? This is a big conversation. And so a lot of people have trouble thinking about health because they're just trying to heal. So who wants to talk about healing? Because I do believe that in our office, we are experts in healing. We've seen thousands of people heal over the last 18 years, and we've healed none of them. What? None of them. We didn't heal one person. Doctors don't heal patients. Patients heal patients. The definition of healer is the person that's next to the patient at the time that their body heals itself. And healing is a universal law. What's a universal law? A universal law is what is true anywhere on this planet, whether you believe in it or not. I'll give you an example that you can all wrap your heads around. Gravity. Excuse me for 1 second. Do you two mind turning around? Because I feel so bad speaking to your backs. And then if you twist your neck, I'm going to feel really bad. I'm going to have to fix it. Which I wouldn't mind. No problem. I should have said something earlier. Help me out. Gravity. So, whether you believe in gravity or not, if you're in New Jersey, New Mexico, or New Zealand and you jump off the roof, you're going to fall. So if healing is a universal law, Dr. Larry, then why are there so many people suffering? Why aren't they healing? Well, you can interfere with the law of gravity. Why aren't those planes falling out of the sky right now? Why isn't this key fob, it used to be keys when I first started doing the talk. Why isn't this key fob falling? I'm interfering with it. I will tell you that one of the main reasons people don't heal is there's interference with the body's healing process. Most people are looking to add on to heal, and here's the secret. Healing is a shedding. It's like a hot air balloon. Usually we got to get rid of. Like if you have a wilting garden, and you give it sun, and you give it water, and it's still wilting, then it doesn't need more sun and more water. What does it need? Maybe there's a spill up the river, and the toxicity's coming into the garden, and we got to fix that and then add on to the garden. So sometimes we got to clean out before we add on. So I'm going to teach you chiropractic in 4 sentences, because it's Tuesday, and that's all we can handle. Your body is self-healing and self-regulating. How many people here have ever cut their finger? What made new skin? The Band-Aid, right? No, the Neosporin, like in the commercial, just grew new skin for you. Or if you broke a bone, and even if you had to get a screw or a plate, what made new bone? Did the plate? No, your body did. What system of the body is responsible for all the healing and regulation of the body?
In there. Right?
Boom, Gary. Gary gets a book. Put that in 5. Give that to somebody. Get us on 60 minutes or 2020, whatever the date line. Okay. The nervous system, it's the brain and the spinal cord. I never hear immune system. I never hear cardiovascular system. It's always the brain and the spinal cord. Your brain and your spinal cord run the show. The quality of your life depends on the quality of your nervous system. Everything you hear, everything you taste, everything you feel, every movement you make, your emotional connection to the world all depends on the quality of your nervous system. Your nervous system is everywhere. If I stripped away, and I would never do this to Dina because I love her, but if I took away all of her muscles and all of her bones and all of her skin, you'd still see Dina sitting here because you'd see her outline in her nerves. And if you don't believe me, just pick up your fork and start poking it around. Anywhere you feel that there's a nerve. I promise. And your nervous system controls every organ, cell, and tissue of your body all of the time. Not all some of the time, and not some all the time. It's all of the time. So if something was interfering with your central nervous system, would you be healthier or sicker?
Sicker.
Every time. Would you heal well or not as well?
Not as well.
Upper Cervical Chiropractors remove nerve interference. Period. That's what we do. We are the only licensed primary care physician in this country that is trained to detect and correct nerve interference. Think about this. Christopher Reeves, right? We all know this tragic story. This man falls off a horse, severs his spinal cord at the level of C2. I don't even want to point to it. C2, up at the top. Did he have headaches and neck pain? No, he lost the communication to his legs. He lost his ability to breathe, and ultimately we know he lost his life tragically too early because of the most severe example of nerve interference. Now, what if you, God forbid, or someone you loved, God forbid, had nerve interference in the same spot, but to 1/100th of a degree? Do you think it could affect the way your legs work, and your body heals, and your lungs work, and your longevity? Absolutely, absolutely. So, Dr. Larry, let's say I buy this, this nerve interference thing, and that's why I'm suffering and not healing. What is nerve interference? In chiropractic, we call it subluxation. Has anybody heard of that word before? Raise your hand. Do me a favor, just say the word subluxation because I just get to hear it once a year. Subluxation. Awesome. You know what? 30 years ago, you didn't even know what cholesterol was, and now you know your number. Okay? So it's a new word, but all subluxation is the chiropractic $5 word for stress. Anybody have any of that? Nobody in this room has stress because you all have a Pilates reformer in your living room. You work out 5 days a week. You have a perfectly ergonomic workstation. You never look down at your smartphone. You never fall asleep on your couch watching Netflix, and Rolf comes over to train you. Nobody here has chemical stress because we all live in New Jersey, breathe the clean New Jersey air, drink the clean New Jersey water, and we're never exposed to any chemicals, insecticides, or pesticides, or Roundup, right? Emotional stress. Are you married? I think it ends there, right? But in all seriousness, guys and gals, we just came out of one of the most stressful periods of time in human history. I'm very proud to say we never closed our office. Thank you, Dr. Cordy. We hung in there strong. Because we knew the fire was burning and we needed to be there. Why become a firefighter and then when everybody's house is burning down, you stay home? There is such a need in the healthcare system because of chronic stress over the last 3 or 4 years. And it hasn't ended. Stress hasn't ended. We had to hire doctors during the pandemic. You can't even get to see a specialist until next year, right?
Right.
This is the sequelae of chronic stress. And the chiropractic adjustment in the upper neck is the safest, gentlest, and most effective way at shutting off the body's stress response. Because what's the opposite of fight or flight? Heal and repair. You can't be in a state of defense and growth at the same time. Impossible. Physiologically, impossible. If you're just trying to survive, you can't thrive. Not possible. You've got to shift your physiology out of fight or flight and into parasympathetic health. So when you have nerve interference in the upper neck, it can affect your eyes, ears, nose, throat, It can cause facial pain, headaches, migraines, vertigo, balance issues, or Meniere's. When you have nerve interference in your lower neck, it affects the nerves to your arms. It can cause neuropathy, which, by the way, we are about to launch an incredible neuropathy program this summer. There is no treatments in Monmouth County for neuropathy other than symptom management. We have a protocol that we are going to release that is going to get to the root cause, which is poor blood supply to the hands and feet. Another story. If you have nerve supply in the lower neck, it can affect your heart, and your lungs, and your thyroid. If you have nerve interference in the middle back, it can cause pain that wraps around your chest. It can affect your stomach and cause reflux. It can affect your gallbladder. If you have nerve interference in your lower thoracic upper lumbar, it can affect your kidneys, liver. If you have nerve interference in your lower back, it can cause sciatica. It can affect your feet, your legs, your balance, your blood flow. It can affect your bowel, your reproductive system, your colon, your bladder, your prostate. Why? Because every single message that comes down into your body has to go through the spinal canal. Now, where's the one place that all those messages have to go through? Your dad was right. You have a hole in your head. It's called the foramen magnum. And that's where your brain meets your spinal cord. So, when your friend said, come meet my chiropractor, they do something different. No, they do something different. What did you picture in your mind? Those YouTube videos, right? You ever see the guy that like pulls up? That is like so detrimental to our profession to show that, because that's not right to do to someone's spine. We would never do that to someone's spine. We don't crack, we don't pop, we don't twist, we don't do that. See, I had played football in the 90s from Manalapan High School. And back in the 90s, they taught us to hit with our heads. Whoever had more scuffs on the helmet got more playing time. So we led with our heads. And I wasn't right after that. And I was attracted to chiropractic for the philosophy that I'm teaching you, where people can get well without putting anything in or without taking anything out. And I get down to Life University in Atlanta back in 1999, and I'm getting adjusted by my first quarter professor in his office, and I feel horrible. I feel worse. I feel like it's BS. I feel like I made a terrible life choice. And I remember calling home to mom and dad and saying, I gotta make a change. And how can I bring this back to my community when it's not even working for me? And I'm telling this story in the hallway of the C building, and one of my classmates, she said, whoa, before you do anything drastic, go listen to this doctor speak on campus. He's an upper cervical doctor. And like you, it was a night like tonight, it was a Wednesday night, I went, but I was from Jersey. Like, hey, so I'm skeptical, right? You got to prove to me, right? And so I go in there, and he brings 6 patients that tell these incredible stories. And I was like, okay, I'm open. I go in as a patient. And for me, when I received my first upper cervical adjustment, that was one of the most spiritual moments in my life, because I knew it in the moment. And it's not this way for everybody. You know, sometimes people get better over time. But for me, I knew in the moment that this is what I was supposed to be doing for the rest of my life. That was just God speaking through me. And so I begged that doctor, can I just come and watch you work? He was seeing patients, and he still does, from all over the world. And I went there every Tuesday. And I'm glad I did. Because 300,000 visits later, and 18 doctors that have come through our practice, and the thousands of people that we've affected. And I, to this day, still don't remember who that was that told me to go that day. And she doesn't know how many thousands of lives she saved because she had the courage to share with me. So for those of you who are patients that brought a guest tonight, you never know how far-reaching something you say today can affect the lives of thousands tomorrow. That's the ripple effect. So Upper Cervical Care is quite different. When I came out of school, there were 80,000 chiropractors. Do you know how many upper cervical doctors were in New Jersey? 3. Do you know how many were in Monmouth County, Middlesex County, and Ocean County? 0. So there I am with my spine and with my table, and I knew I had a force for good, and I'm going to go do some good now. And so the upper cervical work is quite different, and it's a misnomer because it doesn't mean that we only take care of necks and headaches. Remember how we talked about Christopher Reeves and how this area affects everything? We can correct the entire spinal column through the upper neck. Gary, stand up for a second, Gary, you're not shy. Go ahead and put your arm out like this. Gary's a big guy, he's bigger than me, right? I'm gonna barely touch his knuckle. Look at his whole body move. His head's moving right now. The whole thing's connected. When you push the back bumper of the car, the front bumper moves. And the way we look at the spine is quite different. This is how it works, folks. Accidents and injuries throughout the course of our life tear loose connective tissue. And it shows up as a tilting of the head, a tilting of the shoulder, a twisting of the framework. If I get hit from this side, my body goes this way. If I get hit from this side, my body goes this way. What's the one place my body can't go? It can't go into the ground. So what it does is it turns. And so if I had a brand new can of Coke, I had Coke here. They took my Coke away. I don't drink it, but I use it as a metaphor. So if I had a brand new can of Coke, you cannot collapse it. Why? Because it's got structural integrity. And that's the way your mama made your spine. It cannot collapse this way. But what if I take that same can of Coke and I twist it a little bit? The whole thing just goes. And so what happens is over the course of your life, you have these accidents, injuries, and trauma that result in this shift in your body framework, but you don't have any pain. It just leads to an abnormal movement pattern that over time leads to a progressive wear and tear, and then eventually 10, 20 years later, the pain comes. And you go to the orthopedic, and they take your MRI or X-ray, and they go, there's your problem. You have a disc herniation, you have stenosis, you have degeneration, you have arthritis, you have osteoarthritis at C5, C6, and you're smart because you came to my dinner, and you go to the doctor, well, how old are the other bones? Because if it was aging, which is BS, you'd have it everywhere at the same time. Most people don't need both knees at the same time. They get a knee, and then 5 years later, they need the other knee, right? Your body will break down wherever the mechanical stress has been. And by the time the disc herniates and the pain comes, that's like the heart attack. The man who had a heart attack, his heart didn't go bad that day. Those arteries were plaquing for years. And that stenosis was growing for years. And the cause of that was uncorrected spinal trauma. And so any patient that comes to my office with their cervical MRI or their lumbar x-rays, I know that that doctor doesn't understand mechanics. Because you cannot correct the spine without understanding what the whole spine is doing, because it's an organ. Could you imagine going to the cardiologist and they just look at the right side of the heart? Or your dentist only takes care of the top of your teeth? How could you possibly correct this most complex system with only looking at one part and doing it while the person's laying down on a table? We take all of our spinal imaging standing. We take the whole spine. We want to see how the whole spine is reacting to gravity, and we are the only game in town that does this. I have neurosurgeons come to my office. Your neurosurgeon called my office, and I show them the x-rays, and they have no clue of what I'm talking about. They do understand how to put a fusion in, or a cage, or cut the nerve, or burn the nerve, but they don't understand these spinal mechanics. And you would never take a collapsing Coke can and push into it. That's why we don't do that. We release it. We release it. And we release this whole system through the upper neck. And it's unfortunately been a secret. But that's why we're here tonight, so it's no longer a secret. So, the Journal of Neurosurgery, January 2017, said that a thoracic kyphosis is the largest corollary to length of life. Why? Because as your body curls in like this, it increases the pressure on your heart and lungs. It raises your blood pressure. This is not about bad backs and bad necks, people. This is about your lifeline, your connection, staying connected. This is your internal Bluetooth, okay? So, it was May 2nd, right? We're coming back to that date. It was May 2nd, 2005. Mama's behind the front desk. I'm shaking in my pants. And the first patient comes in, and her name is Linda. And Linda, at the time, was a nurse at Sloan Kettering. And she was patient number 1. And here we are 18 years later. And Miss Linda's here tonight with us. Where's Miss Linda? And Miss Linda has agreed to share her experience as patient number 1, a member of our practice over these last 18 years, from the perspective of a highly trained health professional. She's going to share her experience with all of you tonight, and I want you to just envelop her in the love that I feel for her. Thank you. Come on up, Linda.
our anniversary and a reminder every year.
Hi everyone. I was just so moved again by Dr. Larry, which is what I call him, just remembering my journey and just everything he said, take it in. As he said, I was a nurse at Sloan Kettering. I had been there about 20-something years when I moved to New Jersey. And during that time, I had been suffering with migraine headaches, and all nurses have low back pain, is what they call it, low back pain. So for the migraine headaches, I saw a doctor, and he ordered me, he gave me a prescription of not just Tylenol or ibuprofen, but I got a real prescription for migraine headaches, which I would take when I needed it, which was quite frequently in my profession, but, and that would get me through the day. All I was doing was trying to get through the day. Then with the low back pain, that was more serious for me. And a lot of times my family didn't even know what was going on because I don't like telling people my problems or what I'm dealing with. I had sciatica, and I would not look forward to, but I knew that when the sciatic pain started from here going down my leg, either side, and it took, it decided which side it wanted to work on that month. I knew that I had 3 days out of work because I needed to rest for 3 days is what the doctors told me. I had a brace made for my back, one of those warm and foam braces that I had to work in. But I didn't get relief for at least 3 days. So it got to the point where after so many months, I've had some bad years, and then I was in 2 car accidents, not my fault, no fault, within 1 year, which exacerbated everything, just made it worse. So I had of course, a part of the treatment with the accident was to go to a chiropractor. So I did what they told me I had to do for the insurance purposes, etc. And they took my neck and all of a sudden, crack, which I didn't like, made me nervous, it made me not want to go back. So needless to say, my therapy wasn't that great. Then they would do the back and crack, jump, not really jump on, but just press it so hard. And I don't like pain. I don't like to see anybody in pain. But I decided that that wasn't for me. So I just took the ibuprofen. I did what they told me to do. If I had to be out from work, I was just out from work. And I'm one that I'm always early. I don't like being off. I had a perfect attendance record. But this particular year, I was called into HR because I had taken so many days off for just being out. And it was because of the sciatica and the migraines, etc. Forget life, Dr. Larry has so beautifully stated how we all under certain stress, all of us at some level. But it got to the point where I just learned to live with it. I said, okay, so this many days out of the month, I know I'm gonna be in bed for 3 days at least. And it just carried on and on without belaboring the point. I moved to New Jersey about 19 years ago. I had family here, my sister and her husband, family here. So I moved here, and I was one of those that was strolling the mall that day. Because I'm a mall walker, I'm a mall shopper, and we were just going on the mall. A friend of mine had come down from New York, and I was showing her my place, and we just said, oh, let's go to the mall. I need some things for the house or whatever. So we were walking in the mall, and then I come across these 2 gentlemen there, and like he said, he had his table and his spine and some other things. And my friend said, she says, well, you've always had this problem. Maybe just stop and listen to him at least. I said, it's gonna be the same thing. I don't wanna go to another chiropractor. But something in me, and I don't believe things just happenstance. I believe that everything happens for a reason. I've learned that throughout my life, that things do happen for a reason. So we stopped, we chatted, and I found it, I said, I was a little leery at first. But I listened. I took the card, made an appointment to come into the office. And tried not to get emotional. That day really changed my life. Prior to this, when I had the sciatica, sometimes I couldn't even stand. And at the time I was living alone. And I would have to drag myself just to get to the restroom, to get to the bathroom, to get around the house. But yet, I didn't want to tell anybody because everybody's busy, have their own problems, so I just dealt with it. So when I started here at Upper Cervical Chiropractic. It was one of the best things that happened in my life. I said it was a lifesaver for me, because I know what I had been dealing with, and the things I had no more. Migraines are a thing of the past, thank God. The low back pain, the braces I had, I look at them, throw them out. Don't need you guys anymore. Because when I went into the office and the treatment that they give, it was so gentle and whatever. I'm like, what is that gonna do? But they knew what they were doing. And I am so grateful. When I say grateful for just the knowledge, because I had never heard of Upper Cervical Chiropractic. We all have heard of chiropractors, what they do, we've seen it. Some of us have experienced it. I'm sure everybody has a story. And every time I hear the story about Stephanie and Pat and the others, things that have happened, it reminds me of how important this is. And I have friends that have had certain difficulty situations, and they've been in. And every time somebody says something to me about having a problem medically, I said, try Upper Cervical. Try Upper Cervical. I said, just try it. They'd never heard of it. And I tried to get them to come to the practice. A few of them did. Some even out of town have tried it where they are. And recently I went out of the country, and I was able to recommend Upper Cervical to someone in Egypt.
Wow.
And it's life-changing. We say this, and I'm not being paid to say to do anything. And I know a lot of us here are, we're members of the practice, so we know what it can do. But something that is so important to all of us, and that can save lives, save our family lives. I hate seeing anybody suffer. And when I see them, I say, please try it. I said, here, you can do this. I don't push it, but I tell them sometimes my story. And they didn't know some of the things I dealt with. And after I tell them, it's like, really, why didn't you say anything? I said, well, you couldn't do anything. I did what they told me, go to the doctors. But I just want to say, I thank God for this practice, for this particular type of treatment, because it really has saved my life. Because I've seen myself not finishing my career. I heard him mention something about people had to put school on hold, which I had to do, because I couldn't last. I couldn't complete what I wanted to do. But I thank God that I made it this far, and I'm doing this. And I'm just grateful that the doors were open, and that Dr. Larry was there, and all of the other doctors that have come through the practice. And I've seen so many changes, so many things that have changed, but they have never changed. They're the same. And if you've got a question mark in your head, just give it a try. I say just try. You don't have to stay there if you don't want to. If it doesn't help you, that's you. But I know that it works. So I'm just glad for this time and space. Thank you.
So it's just a mission. It's a mission. When you know something that can help people, you share it. And that's what this all is for all of us. And